Hello everyone, welcome to my channel Simplified Dentistry with Dr. Maheen K, and today we will discuss indirect retainers in detail. So what is exactly an indirect retainer? An indirect retainer is basically a component of RPD, right, that will assist the direct retainers. It prevents displacement of the RPD with the help of a lever action on the opposite of the fulcrum line, right? So, now what are the points to remember in this? Firstly, we have to understand that an RPD consists of direct retainers, right, and minor connectors, right? So, what is the role of the indirect connector in this? The indirect connectors are also a component of RPD, right? But it enhances retention of RPD, right? So it helps and assists the direct retainers and hence enhances the retention in RPD, right? So what is the way to remember this definition? Because it's a long definition, it's quite difficult for everyone to memorize. So one thing it is clear, that is these are component of RPD. So an indirect retainer is a component of RPD. It helps the direct retainer, right, which is all itself is a component of RPD, right? So component of RPD helps direct retainer, prevents displacement by lever action on the opposite side of the fulcrum line, right? So if you remember these 5 points, it will be easy for you to memorize the definition. So again, we'll repeat it for the last time, that indirect retainers are component of RPDs which help the direct retainer in prevention of displacement by lever action on the opposite side of the fulcrum line. Easy? Okay, so now we'll be discussing indirect retainers in detail. And the first and most important thing is the principle of indirect retainers. And if we understand this principle, it will be very easy for us to understand the rest of the topic, right? So, here we can see a figure in which there is this base, right? This green part is the base, the blue body or beam, and this red part denotes the fulcrum. So, the fulcrum connects the body to the base, right? The beam to the base is connected via the fulcrum, right? And fulcrum is the point where the body will move or displace, right? Now coming to the second figure, where we have a fulcrum just in contact with the beam, right? And let me clear this, that it is just in contact with the beam, it's not attached to it or glued to it, right? It's not connected to it, right? So then we apply an external force, right, a pulling force, right? And this we are doing in the case where it is just connected point, just in point connect contact to it, not connected to it, right? So what is natural to happen? The beam will displace, it will move from its position, it will move either this way or this way, but it will move when an external force is applied, when the fulcrum is not attached to the beam or the body, right? For example, if we have these two objects, right, and they both are in point contact, and I apply an external force to this red object, this moves, right? But if I glue them together, I connect them together, and then I try to apply an external force, will I be able to move this red object only? No, right? It would resist the external force, right? So coming to the figure number 3. Now what happens is that To prevent the displacement or dislodgement, we can place the direct retainers on the fulcrum, right? And this will be placed on the point contact of the fulcrum and the beam, the direct retainer, and hence it attaches the fulcrum to the beam. Now the beam and the fulcrum are connected to each other. They are not in point contact in presence of a direct retainer, they are connected to each other. And then a pulling force is applied. Now what will happen? Now there will be no displacement, right? Whereas there was displacement in absence of the direct retainer. There was displacement, right? So the direct retainer will prevent displacement, right? But still the beam has the capability to rotate, right? It can yet rotate. It can dangle a little, right? So to gain that stability to not to rotate also, we have the indirect retainers, right? And where will we place the indirect retainer? We will place the indirect retainer opposite to the fulcrum line so that it can act as a lever and enhance the direct retainer, right? So here the indirect retainer is uh, kept opposite to the fulcrum line in order to prevent any rotational movement and enhance the direct retainer and act as a lever, right? So what is an example of this? An example of this is the distal extension denture base, right? In Kennedy's class 1, Kennedy's class 1, right? So what happens in that is there's a distal extension denture base in which the indirect retainer will be the occlusal rest, right? I hope this principle is now clear to you, and now we'll jump on to the another section. Okay, so now we'll be discussing the factors affecting indirect retainers. First and foremost is the effectiveness of the direct retainer. So what does this basically mean? It means that the direct retainer is not rigidly fixed or attached. If it is not functioning properly, it will lead to displacement. So even if in the presence of indirect connectors, where direct connectors are not working properly, then there will be still displacement. So what do we understand by this? That the direct connector is directly proportional to indirect connector. So hence if there is an increase in displacement of the direct connector, there will be increase in displacement of the indirect connector, right? So the second point is that there is a distance from the fulcrum line. The further we keep our indirect retainer, the more stable the beam would be. So this is the beam and this is the fulcrum line, right? So the farther we'll put it, like if we are putting it over here, the indirect retainer, the more stable it would be. So increased distance is directly proportional to stability of the indirect connector, right? Then coming to the third point, rigidity of the minor connector. So what does this mean? So when we place the indirect connector on the occlusal rest, the occlusal rest has to be connected to the major connector, and that can be only achieved by a minor connector. So the rigidity of the minor connector is extremely important. Strong minor connector is important so that the occlusal rest forces are transmitted to the major connector. So if only the minor connector is working properly, there will be a successful transfer of forces from the uh, occlusal rest to the major connector. So hence rigidity is directly proportional to the strength of minor connector, right? Then there's the effectiveness of the support of tooth or teeth, right? What does this mean? Now, the abutment tooth or the supporting tooth needs to be very strong, right? The tooth on which we are using as an abutment or as a support needs to be very strong, right? And the forces and the uh, uh, so the fourth point is that effectiveness of the support tooth and teeth. What does this mean? The abutment tooth basically or the supporting tooth needs to be very strong. So for example, this is the area that has the cingulum and it has a fossa, and the forces are directly transmitted to the ridge, right? So it has to be applied, and the tooth should be strong enough so the forces are applied to the ridge only, right? However, if we do the incorrect way, the incorrect method to do this is that the seat is basically placed into the cuspal lines, right? Over here and here, right? I'll use a different marker. For example, this part and this part is used as the rest seat, and the rest seat is being placed on the cuspal line angles, and because of which the forces will either transmit buccally or lingually, right? And this is that which we don't want. We want the forces to be transmitted to the ridge, and the correct way to do so is to apply the forces directly to the ridge, right? So we cannot place an iron indirect connector where we have weak cuspal line angles. It has to be placed on the rest seat and the cusp, right? So these were the factors affecting the indirect retainers. Now we'll jump into the next topic. Okay, so now we'll be discussing the types of the indirect retainers. The first and foremost type is the auxiliary occlusal rest. The auxiliary occlusal rest is called so because auxiliary means extra, and since the direct retainers already have their primary occlusal rest already, and this one is an extra, so hence it is called the auxiliary occlusal rest. Here we can see that I have donated these with 5 that is the premolars, and this is basically Kennedy's classification one with distal extension base. So there will be a fulcrum line, and from the distal aspect we draw a perpendicular line. From the distal aspect of these premolars we draw this perpendicular line, and there is another fulcrum line going upwards perpendicularly, right? And in this we will place the indirect connectors between 3 and 4, right? And another example is Kennedy's class 2. This is Kennedy's class 2, this is Kennedy's class 1, and in class 2 the occlusal rest will be present in between 4 and 5, right? This will be where the indirect retainer is to be placed, right? After this we have the canine extension from the occlusal rest, and canines are on which the indirect retainers will be kept, and that will be connected to the major connector, right? And in this case these are the first premolars, and the canine is present over here, and we will use the canines to place the indirect retainers, and hence this will be connected to the major connector. The next is the continuous bar retention retainer, right? So what happens in these that the premolars and the molars in the distal extension base is present, and the red mark is basically the canines, right? And in which we fabricate over in our RPD, and this will help and rest on the cingulum area of the anterior and prevent rotation. So in indirect retainers are on canine, and it will be extended in the form of a linguoplate. So it is also known as the lingoplate. The continuous bar retainers are also known as the lingoplates, right? Okay, so we have the last two types, that is the modification and the canine rest. The modification type is the here we have a Kennedy's class 2 present, in which there is a edentulous area with a modification space present, and we can see that the fulcrum line is going between the first premolar and the second premolar. So there's a rule that we follow. What is that rule? The rule is that when in the presence of a second premolar, the fulcrum line is too close to the second premolar, the first premolar is chosen. This is a theoretical rule that we apply, right? And the fifth type is the canine rest. So what does the canine rest suggest? Canine rest is placed in those cases where the mesial marginal ridge of the first premolar is too close to the fulcrum line. So we choose to place the canine rest, right? So here we have wrapped up all five types of the indirect retainers, that is auxiliary occlusal rest, canine extension from occlusal rest, continuous bar retainers, modification, and lastly the canine rest. So guys, hope you like the video. Please like, share and subscribe. There's a lot of effort that goes into one video. So I would appreciate if you like, share and subscribe. Stay tuned for more videos and comment down below on which you would like to see a video next.